So now that we've discussed how common and underdiagnosed iron deficiency is, particularly in women, let's talk about what we can do about it. Before we dive into iron supplementation strategies, first I want to make sure that we're talking a little bit about diet and what we can do to increase our iron intake naturally through our food. Generally, dietary iron is split up into two categories. You have your heme iron and your non-heme iron. Your heme irons are mainly going to come from your animal products, so particularly your meats and your seafood. Your non-heme iron typically comes from your plant sources, so plants that are higher in iron include beans, legumes, lentils, dates, figs, raisins, all great in iron, spinach, also an excellent iron source. The non-heme or plant-based iron sources can be a little bit harder for our bodies to digest, so adding vitamin C can actually be a helpful tool to improve digestion of iron. The foods rich in vitamin C typically include our citrus fruits, so lemons, limes, oranges, kiwis, strawberries, as well as broccoli and spinach. Another thing we can do to help increase dietary iron is actually cooking with a cast iron pan. Other than dietary intake, the other way we can improve iron or ferritin levels, which is our body's long-term storage of iron, is to add an iron supplement. Generally, iron supplements come in two different forms, tablets and a liquid solution. There's actually been quite a bit of debate within the medical community regarding the best way to take these iron supplements. A more recent study published in 2023 gives us a little bit more insight into which regimen might be the best. This study split patients up into 3 different groups. One of the arms of the study instructed patients to take the iron supplement 2 to 3 times per day. The second group was instructed to take their iron supplement once per day, and the third group took theirs once every other day. Overall, the study did find that taking iron 2 to 3 times a day did raise the ferritin levels faster than the other 2 groups. However, this group also had the most side effects by far. The group that took their iron supplement once per day had a slightly faster rate of increase in ferritin levels compared to the group that took their iron supplement once every other day. However, again, they had more side effects than the group that took their supplement every other day. Essentially, this study tells us that we should consider 2 different strategies for iron supplementation regimens. If the patient is overall more worried about side effects, then it might be best to use the every other day dosing strategy. If the patient is primarily worried about increasing the ferritin level and correcting that iron deficiency as fast as possible, then it might be worthwhile to dose it 2 or even 3 times a day.